Daycare infections may mean fewer sick days later. All three of my children started out in daycare as infants, and the daycare center was, in so many ways, at the center of our lives for years. The teachers taught us most of what we knew about young children, including, I am sorry to say, the difference between well-meaning parents and truly talented professionals. The daycare cohort provided my children with their close friends, who keep turning up in their high school and college classes. We even bought our house so we could live near the daycare center. But yes, there were the infections. The worst battles my husband and I had were fought when a small child had to stay home with fever or diarrhea, and we had the eternally nasty whose work day is more important, mine or yours, and just what makes you think so discussion. On the other hand, as our children got a little bigger, the infections essentially vanished. They had nearly perfect attendance records by the time they got to kindergarten and beyond. In a study published last month in the journal Pediatrics, researchers in the Netherlands followed a large group of children over the first 6 years of their lives, looking at how often doctors diagnosed acute gastroenteritis, the stomach bugs so familiar to parents. 1,344 out of the total 2,220 children studied attended daycare during the first year of life. Being in daycare as an infant increased a child's risk of having acute gastroenteritis in the first year of life, but it also had a protective effect after that. Interestingly, the protective effect lasted at least till age 6, which is as far as the study went. The children who were in daycare by the age of 1 had more gastroenteritis earlier, but the non-daycare children got sick more often as they got older. By age 6, children in the two groups averaged similar numbers of total episodes. We think if you are infected at an early age you build up immunity against these viruses or bacteria, said Mary Eek de Hoog, an epidemiologist at University Medical Center Utrecht and the senior author on the study. There is even a possibility that the protective effect we have seen will continue when children grow up. We need more research. Daycare attendance is known to be a risk factor for upper respiratory infections, which are much more frequent than gastroenteritis. The average child may have as many as 8 upper respiratory infections a year, to maybe 1 bout of gastroenteritis, said Dr. Timothy Shope, an associate professor of pediatrics at Children's Hospital of Pittsburgh, who is the co-editor of the American Academy of Pediatrics book Managing Infectious Diseases in Childcare and Schools, a quick reference guide, the 4th edition of which is due out next month. And going to daycare also puts a child at higher risk for the ear infections that can follow those upper respiratory infections. In fact, the gastroenteritis study from the Netherlands was an offshoot of a larger study focused on respiratory infections in children, and Dr. de Hoog and her colleagues published an article in 2014 in which they demonstrated a similar pattern in upper respiratory infections and ear infections. Children who attended daycare in the first year of life had more infections earlier and fewer later. For the early daycare group, this led to more doctor visits overall, and more antibiotics.